Light therapy is basically what it sounds like, and most people have probably heard it being used in context of a seasonal adjustment disorder, where we get the blues in the wintertime when it's really dark outside. The device is called a light therapy box, and there are several different kinds. We've got some samples of sort of a medium-sized one, and then one that's really small but portable. They're equally powerful. And basically what it does is mimic the light, the artificial light that we have today. And it stimulates the brain transmitters that affect mood and sleep. For sure there are other uses. And when we talk about other uses, it would be a good idea to discuss your use of the light therapy box with your health practitioner. Certainly other depressions is helped by this particular product, as well as things like jet lag. It's really helpful for that. If you're changing shifts, night shift, day shift, helping to regulate your circadian rhythm change is really helpful. And there's even some evidence now that using it in dementia is helpful as well. Well, again, discuss it with your health practitioner, but generally it is a very safe kind of therapy. If the side effects do occur, they're very short-lived and very mild. Things like eye strain, nausea, headache. One of the ones that I find interesting is that people can become hyperactive with it. So if you have a bipolar condition, you may want to see if that's really not one of the problems with you, making your mania more hyperactive. And there's certain things that you may want to really avoid the light therapy. Certain skin conditions like lupus, certain retinal conditions or glaucoma, and also certain medications may influence your sensitivity to the light. Well, it's really interesting because if you're going to respond to this, it will be effective in terms of achieving some results within about a week. The problem is that you have to be consistent with the timing in terms of doing it on a regular basis, always at the same time of the day, and then continue to use it till you get your symptom relief. And the other thing is that you want to make sure that you use it in the morning time. The natural thing is that you think you should take it at night, but it's the morning time and it shuts off your melatonin and helps you get into the circadian rhythm, which helps you to be more awake during the day and more energy, as well as getting a better sleep at night. Well, certainly depending on the product you get, each of them has specific instruction. There are some basic principles. The device, in terms of intensity, is measured in Lux units, and it'll tell you that this unit will provide 10,000 lux when you're being exposed to it. And that's sort of a moderate level, most average. If it's a lower lux, you need a longer time. So with a 10,000 lux apparatus, you may have to use it for about 20 or 30 minutes, and you need to be exposed about maybe 1.5 to 2 feet away. And the big thing is, it has to make contact with your eyes. It can't just be shining on your legs or your back, but you don't want to look directly in, because it can affect your retina. You can multitask. You can do your reading, you can do your computer work, you can talk to your wife while you're doing it, and you both be exposed. But it's being consistent and doing it on a regular basis.